You can see it on social media as well, where there's a kind of a blossoming wave of negative conversations around things non-surgical and the inadequacies and the ineffectiveness of this. And again, it doesn't mean that these things should not be used. It's just that the expectations that were associated with their use was wrong. If you're telling somebody, hey, you can use this in place of surgery, and they end up using it and it doesn't replace surgery, it doesn't get them anywhere. Patients are also sharing their negative experiences with Morpheus 8. You saw that there's an FDA piece about that, Ultherapy, threads, and it's finally starting to resonate. And I think ultimately this is a good thing to have perspective in terms of expectations around this topic. And what I'm sensing a lot more is there's a narrative that's shifting away from, I can try to avoid surgery, to, I'm actually not going to waste my time and money on things that don't work. So to be clear, I've been saying this for years. I've been trying to educate and offer my experience from my patients and the observations that I've had from thousands of people that I interact with on a regular basis. But it's nice to see some of this is starting to percolate, and more and more people are starting to make better decisions. And ultimately, as long as you know the facts and the information around these decisions, you should be able to make the right one for yourself. And that's what this is all about ultimately. But I have to say, it is nice to see that there is a broader industry-wide and patient base that are catching up to some of the things that I've been talking about. And when I used to initially talk about them, it was met with so much resistance and almost shock that I'm saying these sort of things. So it's nice to see that there's a little catch-up going on here.